You are.
I'll give you the thumbs up when it says you're live. I thought I did go live.
Ready?
Yep.
Okay, it is Thursday, May 21st. Lewis County, as well as the North Country, is currently in phase 1 of the regional reopening. All of our numbers on the regional dashboard have held steady so far, which is wonderful news as we've moved through the first few days of the phase 1 reopening. Phase 2 will be scheduled for June 1st. So we are allowed to move through the phases every 2 weeks as long as the numbers on our regional dashboard that we're keeping track of in the control room remain in check with the state standards, which so far we've been able to do. Phase 2 on June 1st would include professional services, finance, insurance, retail, administrative support, real estate, rental, leasing, and as everyone has been anticipating, hair salons will be in phase 2 as well. Phase 2 will also include government buildings. So we are choosing to bring our buildings back online in the phase 2 process. The courthouse will be reopened to the public with phase 2 on June 1st. And we will have our June 2nd Board of Legislators meeting here in the chambers for the first time in 3 months. That is the plan. Of course, that's all contingent upon keeping the regional numbers in check and making sure that Lewis County continues to follow all the PAWS New York standards. Just a note, as we move through the phases, social distancing is still very important. So here at the courthouse, even though we'll be reopening to the public, we will still, you'll notice some changes when you come in. We will have plexiglass shields in front of all areas that would have direct public interaction. We will have stickers and markings on the hallway floors to keep people separated and safe from one another. You'll notice our staff wearing masks, and we expect the public that comes in to wear masks. That's going to be a requirement to come into our buildings. You'll have to wear a mask, and you'll get screened at the front door for temperature checks by the courthouse security. I want to make a note that the June 1st date does not include the Department of Motor Vehicles. The DMV is on a separate schedule set by the state DMV, and I'll leave that to the state and to Clerk Mosier to announce reopening plans for that. If you follow the 2-week phases, that means we would reach phase 3 by June 15th. Phase 3 would be restaurants and food service. And phase 4, which is arts, entertainment, recreation, and education, and religious services, we now know, that would be back online by June 30th. There is one additional announcement with religious services. The governor has said this week that religious services can take place with 10 or less individuals starting right now. So that is part of the new standards from the governor. 10 or less individuals can get together right now. The last thing I want to say about regional reopening is that the IDA, the Lewis County IDA, the Chamber, and the Planning Department are putting together reopening kits. So these kits are going to have masks, hand sanitizer, gloves, soap, and so we're ordering those right now. We're putting them together. I can't say enough about the Chamber, the IDA, basically the business support community that is part of our government apparatus, and it has been wonderful, wonderful, wonderful. Any business that has questions about what they need to do to reopen, what type of equipment they're going to need to keep their staff safe, to keep the public safe, that can all be filtered through our economic development team with Naturally Lewis. They're doing wonderful things. I want to reiterate that PAWS New York is still in effect, okay? So we're moving through the phases of reopening, but that doesn't mean that the The larger aspects of pause are not still in effect. There's still no gatherings of any size, public or private property. That is the law in New York State. Social distancing is required, meaning 6 feet of distance between people at all times. And if you can't observe social distancing, then you should be wearing your masks in public spaces. Lastly, I want to touch briefly on testing. Regionally, we have been able to maintain the pace of 12,900 tests per month. That is the pace that we need to maintain in order to continue through the reopening process. In Lewis County, that means we have to perform 810 tests per month, which we have been able to do so far, basically because we're testing nursing home staff twice a week. That is, over 500 tests per week just in nursing home staff alone. So that easily puts us over the 810 per month threshold. But we are also testing other essential workers, first responders, and healthcare workers. So we are beginning to expand testing in Lewis County. Hopefully, over the next couple weeks, we'll be able to expand that even further and reach out to the general public and people that are not essential workers or healthcare workers or first responders. And if anyone who wants to get a test, hopefully we can reach that level, but not right now. It'll certainly be some time. I also want to touch briefly on the issue of false positives. That's something that has come up here in Lewis County. It's going to come up everywhere in the United States as we ramp up our testing. It's just simple math. If you do enough tests, you're going to have some false positives. But what I want to reiterate more than anything is that testing is the way out of this virus situation for the world. It's going to take testing, tracing, and isolating. Testing people on a wide scale so that we understand where the virus is in our community, tracing the contacts of those people that test positive, and then isolating those groups so that we can isolate this virus so that it cannot spread widely through the entire community. We have to have faith that testing is going to be the way to keep our community safe. And even if we have a small percentage, even statistically, that come in false positive, it does not mean that we don't need to take those seriously. If you get a call from public health, it is very important that you cooperate, that you be kind. Our public health officials are doing the best that they can to keep everybody safe. And even if you believe that you are a contact of someone that is false positive, please be respectful and understand that we're trying to do our best to keep the community safe. So we have to believe in testing as a community. I think that's very important, even though we're going to have to negotiate some of the nuances of the false positives and the impact that has on some of our staff. I think we are, a community that is capable of handling these nuanced issues, and so that's what we're going to have to do in order to go forward. So with that, I know that our hospital CEO, our health system CEO, Jerry Kayer, has some comments. So we'll have Jerry take some comments, and then we'll all take questions. So.
Okay, thank you, Ryan. A few updates. So I agree with Ryan. Testing is important, and because we are addressing the false positive issue, is not in any way intended to suggest we should not have a testing program in the county. So two different topics.
Mm-hmm.
So unfortunately at this point we have made no headway on the issue that I've been discussing now for the better almost a week. So when all else fails, it's important to be reminded of what is the language, what is the directive, what is the guidance. So I'm going to read it to you. New York State Department of Health's guidance mirrored the CDC's position. However, going forward, we will no longer adhere to the CDC's standard on this issue and will instead require that nursing home employees who test positive for COVID-19 but remained asymptomatic are not eligible to return to work for 14 days from that first positive test date in any situation. And I want to repeat, in any situation. and will no longer adhere to the shorter CDC timeframe. So, you know, quite honestly, I do believe these are false positives, but this is the directive. This is the guidance. It's not as the health system CEO, I can pick and choose which directives I will follow. I am obligated, and I think morally responsible, for following the regulations, for following the laws. In our society, there is a process for us if we disagree with a regulation or we disagree with a law, and I'm working through that process right now. The first step in that process is expressing your concern with the regulation. The second step in the process is working with those in your profession and the associations that represent us when dialoguing with the DOH to express why there may be a problem or challenge with the current standard. 3, you write letters, and I am currently drafting a letter to the Department of Health so that it gets put on the record. 4, it is important that it's done in an open, transparent way, and even though I disagree, we are a civilized society. We are a community that is built on laws out of respect for each other, and we're going to follow the laws. There's no grand conspiracy here. I think the regulation is flawed. I think that there's an opportunity to be more proactive, and we're gonna do that. Will this impact the 4 cases we were talking about this weekend? Absolutely not. When you work through the process, work through bureaucracy, it does take time. There are lots of voices, and at the end of the day, when all is said and done, science needs to drive the right answer. And I'm fortunate I have women and men of science, physicians, who I get to consult with every single day. There are such people in the Department of Health. So I do believe the Department of Health, in real good standing, has taken feedback from the field, and people sit in a room and they debate and discuss, and they'll work through this. So that's how we're going to do it. Yes, I'm not pleased that we have 4 people sitting at home today who I wish weren't sitting at home and who could be contributing to our vision and mission by being on campus. So that's where we stand on that issue. I'm going to continue to express at times my profound dissatisfaction as to where we are, but it will always be done in a constructive, engaging way, and isn't about not working in a constructive manner, because our issue, our concern, my concern is not in any way intended to say we should not be testing. We need to be testing. That is sound public health in this situation. And I really do support the efforts of Ashley and her team in our public health department. I think they've done yeoman's work through this entire pandemic, and will continue as the scope of testing expands. Good news on the surgical front. As you know, a couple of weeks ago I was able to report elective outpatient surgeries had started, and we've received additional clarification where now we can do elective inpatient surgery. So what that means in practical sense, hip transplants or hip replacements, we are now able to do. Those are the types of cases that typically require a hospitalization. So we, like many others, have been working really hard to make sure that the elective outpatients did not tie up hospital beds in the event we needed them. And so now we can expand to inpatient surgeries. We continue to test the nursing home employees 2 times per week. I often am questioned around the supplies. Earlier this week from the Department of Health, we received 508 collection kits, and so we're keeping up between the inventory that we're able to pull in from suppliers and the additional DOH stock. We are able to meet the requirement, and we're moving forward on that. I've had questions around staff who refuse to be tested. Now, we're fortunate no one has refused, but it would be fair to say some staff have not been pleased. You know, the bottom line is we have requirements of certain screenings and health tests that must be administered to all of us who work in healthcare. And within the long-term care community right now, swabbing for COVID-19 is one of those that have been added. And if an employee chooses not to be tested, we don't put them down on the chair and do the test. They just will not be able to continue working until they are tested. And so, you know, with education and engagement, I don't think it'll be a major concern for us, and I do think the staff have really done a nice job working with the management team so we can accomplish this goal. We still don't have resolution on paying for the test yet. The commercial insurance market has simply refused under the language of medical necessity. So we continue to work on that, and hopefully with some additional language that I expect will come from the Department of Health and, you know, from the administration. I know our own health systems, health insurance carrier has, you know, said they're not paying for these tests for the nursing home. So we'll continue to work on that and see where we can go. But it's not only a Lewis County issue. This is an issue across the state where these screenings are not being covered. And as we reported not too long ago, on an annualized basis, we are looking at $2.5 million. So it is an issue that will have to be resolved. So those are my updates for this week.
Just to pick up on the testing that you were just talking about with the cost, our understanding is that the state-run lab in Wadsworth is processing them for the nursing home employees at no cost, but there is some issues with capacity there. Is that something that you guys have looked into, or?
Yeah, it's really not an option.
Okay.
So we have a relationship with LabCorp. I think they have served us very well, and we've seen a consistent improvement in turnaround time from when this all began. And I think, Ashley, you would concur. So, you know, the fact of the matter is the cost of the test is the cost of the test, and the cost of the kits that we are buying, you know, it's $100 to analyze the sample, and it's around $6 or $7 now for the kit. And then there's the processing time of the employees at the health system. So we'll continue to work on that, and I have some faith between state government, the insurance industry, and FEMA, and lots of forms later, we will be able to generate, you know, some reimbursement for these tests. So we'll work within the system to do that. But I think we need to continue to express concern that we aren't being paid and not lose sight of that.
And although the mandate only requires you to test the nursing home staff twice weekly, some places are instituting a policy where they're doing residents on a regular basis as well. Is that something that you guys are considering, like setting up where residents get tested once a month or once a week? Or?
Yeah, no, not at this point. There is no science that would support us moving in that direction. Now, if there was some guidance from public health or the Department of Health that said we should think differently, we would certainly do that. But keep in mind, we still have restrictions on outside public coming into the facility. And unless the resident has a medical appointment outside of the facility, they're not leaving the facility. So their risk of exposure is remarkably low. So we are not implementing that. And with regards to essential workers, we simply follow the guidance of public health, and that has worked very well.
So last week you were saying that there was also concerns about getting the tests, like having enough testing capacity. And I know the state or the governor has said a couple times, like, oh, we'll help them with the tests, we'll help them with the tests. Are you better on, like, do you have the test to be able to do it now?
Are you talking about like the supplies?
Yeah, like I remember you said you'd run out by this week.
Yep.
Are you better on that?
Yeah, we are better. Specifically for the nursing home, that was a reference to 508 collection kits received this week. So, you know, in another week or so, you know, we'll have to receive more kits, but they seem to be coming in consistently. And internally meaning with the manager's office and public health, we are doing a daily inventory of collection kits and how they're designated, you know, for the nursing home, essential workers, the emergency room, the COVID clinic, you know, so we have a real good handle on inventory. I think the tracking of all of the tests that we're collecting is a little bit challenging because we have multiple agencies involved, but I think just through routine dialogue, that's being fine-tuned. And as I just said that, I realized I didn't send this morning's inventory to Ryan and Ashley, but it is on my desk and we'll get that done. But the other thing that occurred is Bob McKenzie was able to assist us in getting the tubes that we can put the swab in.
And where they came from, Jerry?
I think the from Otis, is that?
Pretty sure.
Yeah. And do you remember how many we received?
200.
Yeah. Well, I think it was a meaningful number that would allow us to dramatically increase the number of collection kits that we have, and so we're working on that right now. So I guess the point of this is through a number of different avenues, we are getting the collection kits either completed on arrival or the component parts, and then we're building them and making them available.
Is the state helping at all?
But
Are they coming from the state, I mean?
yeah, the 508 came from the state, and then I think a week and a half ago we received a shipment as well. So yeah, we have, I can say the administration and the Department of Health have followed through on that commitment, and that has not been problematic.
With regard to the false positives, certainly they happen, but there's been no discussion of false negatives, which are more prevalent statistically than false positives. Is there concern about that, or how do you, and this could be for either of you, is there like, would it come out in the wash, like people would get symptoms or not, or is that kind of the asymptomatic people that we're finding now, for example, would they then be found later? I'm not phrasing that well, but essentially there are false negatives too. If we happen to find 4 false positives out of that lot, false negatives are harder to detect. But
Yes.
how can you detect them?
Well, for symptomatic individuals that you have a strong feeling may be, retesting is the way to do that. We have not had an issue with that we know of locally.
This repetitive testing in the staff, though, could reveal some of those also, ostensibly, if there were false negatives or...
Well, through repetitive testing, and you continually get the same result, you eliminate or you reflect that, you know, the false are not an issue, you know. And to Ashley's point, on the symptomatic patient, it's very clear. If, you know, if it quacks like a duck, walks like a duck, it's a duck. So if all those clinical symptoms are there and it didn't come back, we simply retest. And our ability to turn around those tests quickly is truly working.
Ashley, can you talk a little bit about, I know people have noticed the uptick in testing lately, and a lot of it, as Jerry has alluded to, has to do with testing the nursing home staff twice a week. Can you kind of break down like what percentage of the tests that we're doing now on a daily basis are coming, or weekly, however you average them, are coming from the nursing home staff, and what are actually the other categories that you're doing with like first responders and things like that?
Yep, so our numbers from the nursing home are lagged because we're adding the results as they come in. So our first week of essential worker testing, approximately 200 essential workers.
Are they randomized from different industries, or are you going into like, certain facilities and testing their whole staff?
We're working with certain groups,
Okay.
yep, and it's based on each group, so it's not necessarily randomized. We're working with those groups to set up the logistics to make that happen for further down the road. The testing this week has slowed down a bit as we work through the reimbursement piece of it.
Okay. And can you just talk a little bit about with the, I'm sorry, I lost my train of thought. With the two most recent positive cases, there wasn't a lot included with them. Is it safe to assume that they're not connected to healthcare or the nursing home staff?
One was an essential worker, and the other had a contact with a positive case not in our county.
Okay. Essential worker as in working at the hospital or a different essential facility?
Working at the hospital.
Okay.
So there has been now one confirmed case
But
in the hospital
that
staff. Staff or?
Also had a negative after.
Is it possible that there is has there been any thought into that maybe some of the people, if there's one person that is taking the test, maybe sometimes, like the 4 in the nursing home to have 4 false positives, could there be a human error in actually obtaining the samples?
Not related to the false positives, you would get no reading, okay? And we have multiple trained individuals collecting the samples, and they're not all tied to one person. So,
Is there a way to tell that? Like
yeah,
you-
based on the date of the sample and who was manning the table, and we don't assign just one person for the whole day. It's several people are taking the samples, and it involves both health system staff and public health staff, and so, yeah, that isn't the issue.
With
So-
the volumes of the lab
It's-
increasing so much, is it, can you kind of
It-
read it?
You're right, it's a volume
Like contamination?
issue. No, it's a volume
At the
issue,
lab?
the number of tests in an asymptomatic population in a county with either the lowest or second lowest infection rate. That's what's really, this is really about. We have increased significantly over the last 3 weeks, the number of tests being administered.
So think about it just in terms of math, right? If we're testing 1,000 people through, health worker staff and nursing home, and the false positive rate for asymptomatic people, remember, none of these people are displaying symptoms. If it's a 0.5% even, and we're testing 1,000 people a week, that means by math alone, you're going to get back 5 positives, which is exactly what we've gotten. So, statistically, it kind of fits into, what we've been seeing and what we've been hearing on the false positive rate. So I think Jerry's exactly right. It's just a matter of the number of tests that we're doing at this point. When you do that many tests, you're going to get some results that are false positives. The point is, we don't lose faith in the testing system because it's still working and it is still our way forward from a public health perspective. And just we have to understand how to balance, the science of the false positives with the staffing levels at the hospital and everything else that we know about, going forward with this COVID-19.
And
Just where did that 0.5%
It's just
statistic come from? Because I tried to look that up, you mentioned that in a phone call, and I've been looking for rates for false positives or false negatives, and it's not clear, not on the CDC or the DOH or any
depends on the
website.
test.
So I was just wondering where that figure
It depends on the
came
test.
from.
It's all over the board. the rates are all over the board as high as 3%.
Right, but you gave that statistic, so I was just wondering
I'm
where
just
it came
saying,
from.
even if it's as low as 0.5% out of, even if the test is 99.5% accurate.
Okay.
But can you, maybe these guys can talk more about testing accuracy, I don't know.
So these tests are authorized by the FDA under emergency use authorization. So typically tests have to have sensitivity and specificity displayed clearly. This is a new test. PCR tests are routinely very reliable. LabCorp is a very reliable lab that we utilize. Their test is a good test, but to get those specific numbers for the specific test with sensitivity and specificity, it's not out there yet.
I haven't heard though, in every county has increased testing by the same, exponentially the same. Some a little less because they were testing so much more to begin with, granted, but there's a lot of low number counties out there. But doing some research, I haven't seen this kind of show of false positives.
Mm-hmm.
And this is why I'm asking the questions. We're not necessarily in line with all other counties with this emergence. Also, we're only doing double tests with positive workers in the health system. So,
Well, it's primarily, and this is just being very practical, the Tri-County region, we're the only county that owns a long-term care facility.
right.
Okay? And we're the only county thereby that has to test a certain density of population twice a week, right?
All nursing homes have to do that.
County owned. The counties, hear me out. We, as a county, owned the facility, okay? So we have to do these tests. I know a little bit about false positives based on my academic training, and it was clear to me that some flags went up and we should retest. One of the ways you verify a false positive is through a retesting process, okay? Now, if it's instead of 4, it had been just 1, I don't think we're talking about false positives and retesting, right? It would have been, geez, we had 1, we'll manage it. But when you get 4 in a population that has gone through the level of screening and questioning every day, coming to work, taking temperatures, restricting visitors, to me, there are enough signals that these may be false positives. So,
But what about this one at the hospital where it hasn't been as...
No, it's not necessarily the hospital. The health system is broader than that, but we're a small enough community. I don't think it's appropriate to outline which department or which section of the organization. So what I can tell you is everyone has been retested at least twice, many more, the 4 more, and they've all come back negative. But it's at this point, that's really not relevant because I started out my part of the conference with reading the language. So we are respecting that, and that for me, I'm going to work through a process of how can we get false positive recognized so that we don't have to keep people out of work for 14 days.
So
I guess what I was asking, sorry, was just that should we also, since we have so few, we're a great test tube for the whole state in truth, we have so few positives in general, at this point, would it make sense to do extra testing to ensure that they also are proper positives? I know it's not standard, but none of this has been standard.
The only other, so you gotta understand, the only other people that tests that have come back positive were for symptomatic people,
Oh, they have all been symptomatic.
except for the most recent 5 that have come through the screening. Everyone
Is
else
that-
has been symptomatic.
Is
One
that
other one
accurate?
was not.
One other one was.
One other one.
So going forward, will we
But
take a
that-
second look at asymptomatic people?
But the one other one had a contact.
Okay, so, okay, now we're
So that's
narrowing it
reason
down.
to believe.
All right, sorry, I'm not questioning that, certainly the retesting makes sense, but the fact that it's been just through the health system and not in the wider population, that's...
And your reasoning behind that, Jerry, to kind of button that down was you're trying to move forward with policies through the Department of Health, so when these situations come up again, you kind of knew there was probably nothing you could do about it this time with bringing these employees back to work. But looking into the future, you wanted to kind of document with a large number of tests, I think they were tested 4 times, to kind of show the false positives, so maybe the Department of Health going forward could give you different guidance on how to treat those cases.
Yeah, well, in the beginning, those first few days, I actually thought I could move the mountain and, Ashley would get guidance that would allow us to release these folks and have them come back to work. And then, I learned a little bit about, New York State bureaucracy and the layers and all of that sort of thing. So then spent my time really trying to understand the language and really create a pathway so we could have, a pragmatic conversation and create places where it can be considered. And if we do that, then just maybe, the guidance will come to us at some point on how to handle individuals when it is suspected that they're false positives. I think that's a place to be. And I do believe in the not too distant future, you're going to see false positives from other long-term care facilities, because the testing is really picking up now, right? We're into, I think, the third week, and not everybody started on the same day. Because of our size and inventory, we were able to start right away. So I think it's going to be an issue that'll filter up. Smart people will take feedback and have deliberative discussion, and maybe we'll be able to move this issue forward. Because testing is going to be around for a while, so I do think it is important to have clarification. And if they are false positives, the resources within public health can be used to manage those that aren't false positives, because we all are working with a limited amount of resource, so we want to be thoughtful and prudent in how we use those.
How impactful is it on the nursing home staff to not have these 4 employees available for 14 days?
It impacts. It's not, but we have vehicles such as overtime, casuals, and reassigning of other duties so we can support it. We're not in a critical place. Is it ideal? No. Are we meeting our obligations? Yes. And but like all things, if you have the appropriate staff around you, managing the needs of the organization, the residents, the patients becomes easier.
Is there any updates on the furloughs at the hospital? Have you started bringing anybody back, or?
Yeah, so we go through a 2-week review, and I believe as of today we have 3 people have returned. And they were in areas that were influenced by volume, and that was one of the guiding principles when we put the furlough program together. And I believe we're at 3 as of today. I think the next 2-week period ends next Friday, so between Tuesday and Friday of next week, the appropriate members of the management team will evaluate, is there adequate volume to bring more back. This is what I shared with the board of directors at our executive committee last week, that I expect each 2-week period we will bring some people back because our volumes are increasing. I do think there will be some who will stay on furlough right to the end. We'll get right to the end of the 8-week period. So that's what I think will happen.
To switch gears a little bit, Ryan, you brought up large gatherings and the fact that you're very helpful.
I'm trying to move the mic.
That large pause is still in effect in large gatherings. You said large gatherings of a certain size, but could you be more precise to refresh for people? At one point it was no more than 50, then it went down to 20, and then it went stay home. So what's the size of gatherings that are prohibited still under pause?
So I think that is something that is absolutely worth clarifying. Right now in New York State, there is no gatherings of any size that are allowed, okay? So the CDC says 10 people. The CDC says 10.
Phase 1 says 10, it was 2.
Phase 1 says 10? Well, I think that...
And Phase 2 says 50.
Well, then I'm not completely clear on that, but regardless, the CDC says 10. The point is, we should not be having large gatherings in Lewis County at this point, really anywhere. You know, you have to think of these, you know, the large gatherings, the keeping your social distance, wearing a mask, for people that are young and healthy and the weather's getting good and we're all ready to get outside and get moving. But you have to think about, you know, all these folks that have been put out of work by the pause, and these people are trying to get back to work. They're trying to feed their family. We're trying to get the economy going again. And when people make decisions that are reckless and make decisions that are not respectful of, you know, our community trying to get back to work, that is harmful to your friends and neighbors that really need to get back to work and start making income so that they can, you know, support their families. So think about that. You know, it's not just about it's nice out and I'm an American and I'm going to go do what I want to do. It's about your friends, it's about your neighbors, it's about folks that work at a restaurant, maybe as a bartender, that haven't been able to work for 3 months now. And if our behavior as a community is such that we have the number of cases increase and the North Country has to stay on pause longer, then those people that are being hurt are your friends and neighbors that aren't able to go back to work. So I think that needs to be the message that we get out to people, that, you know, we have a lot of people that are hurting economically, and the more respectful we can be of the process of reopening, then the quicker we're going to be able to reopen and the quicker everybody's going to get back to work, which I think is very important.
One question I promised to ask today before we get cut off here. On March 26th, Lewis County issued guidance for people coming into the region from the New York metro area. We've had a couple of questions of, is that still something in place that you want these people to kind of self-quarantine for 14 days, or has that changed any since then, or is that still effective guidance?
I think that's going to be tougher as, you know, seasonal camps and things start to really open. You know, when we were talking about that in March, we didn't have, you know, Branningham and Bonaparte and all those lakes open. So you've got people now that are coming in for the weekend, and so, you know, I think it's going to be tough for them to quarantine the whole weekend that they're up here. That's the, you know, the point of coming up to your second property. But people that are coming up and are moving up here, you know, if you spend your winters someplace else and you're coming up here, you know, for the summer months to be on the lake, then yes, we would still expect that you take the time to quarantine yourself and be respectful of your friends and neighbors and make sure that you're not carrying any symptoms through the broader community.
I think we still have it posted in our COVID section.
Yeah.
I think it said until further notice. So is that something you guys are pulling that guidance back now?
No,
or?
it's still in place, but I think we're, you know, reasonable about. We are moving through the phases of reopening, so I think we need to be reasonable. But, you know, people that are coming from those hotter areas that have had outbreaks, I think they still need to be respectful of us, a community that hasn't had problems. So when you do come up here, you're bringing, you know, all of your contacts and everything you've been doing with you. And I think it's appropriate that we still remind those people that we haven't had a large outbreak here in Lewis County, and they need to be respectful of that.
And Ashley, can you just address, since March when this guidance went out, has public health dealt with very many people in this regards?
Yep, 80 households have called, and we're continuing to get calls. We've actually seen an increase in the number of calls, and I think it's due to, you know, Memorial Day weekend. That's kind of the kickoff of people coming up. So we are fully educating them when they call, and answering all of their questions, you know, encouraging that quarantining within their own camp or cottage as much as possible, and just providing that education of what our community looks like compared to, you know, where they've come from.
Oh, also, there was talk in the last meeting about testing at outposts around the county. Is that going to move forward?
We're working our way through the testing steps that have been outlined by the state, right? We do symptomatic people first, healthcare workers, first responders, others essential workers, end to end, the greater public. So we're still in the phase between healthcare workers, first responders, and other essential workers. We're working through that crew. Once we, you know, test all the people that would like to be tested in that arena, we'll move on from there. But still, I think that's going to be a couple weeks.
So essential workers who are living around the county, since they exist in all parts, are to come here to get tested for now.
Yes.
Yes, we're working with specific groups of individuals and working out the logistics of that, and more to come.
Okay.
But did you start testing essential workers this week?
Yeah, we started last week.
Last week.
Mhm.
Okay. And so he asked this earlier when you were talking about it. You're doing it or you're doing it for, like, by the workplace. Like, you're working with
Yes,
organizations.
yes.
And you mentioned something about you slowed down as you were waiting for reimbursement piece. Are you talking about? I guess, what did you mean by that?
So we are trying to determine if this is a cost that is going to be reimbursed by individuals' insurance or the state. And also Wadsworth does accept specimens for free, but they're at capacity. So trying to work through all of those logistics to make sure that we can do this as cost effective as possible.
Gotcha. So essentially, like, if I'm an employee that works at a business, is it my personal insurance that would
cover the
cover
cost.
it, or is it? I mean, could it be like the business has to pay for it, or no, they wouldn't have to?
It's not mandatory.
It's not mandatory
To be
testing,
tested.
right?
Gotcha.
So it'd be up to the business. But we're still working through that to determine
Like, who pays
a
for
payer
it?
source. Yes.
Gotcha. Okay. Thank
So
you.
has it slowed down, or you're at least testing to meet the minimums for the county?
We're testing to meet the minimum. Yes.
Are we going above that or not until we have more payer information, I would imagine?
Right. Correct.
And I just had one last question for Jerry. We got notification this morning with the lobby changes that the lobby at the hospital will be closed on the weekends going forward. Just kind of wanted to ask, was there any specific reasoning behind that, or?
Yes, over the last 3 weekends, we've been monitoring the foot traffic coming through the lobby, and we have to staff that, and the numbers have been incredibly low, and what that means is less than 20. So we are staffing the entrance at the emergency department, so it's really an efficiency adjustment based on the lack of volume using those doors. And the reason for that is not having families of the nursing home residents, which is primarily how they would have accessed the facility. Without that happening, our volumes are incredibly low. So it seemed, not very cost effective and quite silly to staff 2 tables where one is pretty consistently there's foot traffic coming through and the other there wasn't. So that's what's driving that.
Okay. And there were a lot of activities going on at the hospital last week for the celebration for the staffs and things like that. Did you just want to talk about some of the things that were done for the staff members?
Yeah, it's like most celebrations in the American culture. It was lots of food, gift cards, and raffles, recognition of individuals serving, our organization in the community for, 5, 10, 15, 20, 25, 30, 35 years. But with this overlay of social distancing. So there weren't the gatherings, there weren't the same type of attaboys and groups. But we were able to, I think the team did a nice job finding opportunities to say thank you. But all of us consumed more calories than we probably should have.
Have the elective surgeries helped to bridge the deficits? Have things improved? Are you about to break even, at least since they've been back? Where is that at?
Yeah, it's too early to say. We had an operating loss for the month of April, and today is May 21st. So, the indication is we've had a strong surgical performance, and that has a significant influence on the bottom line each month. So we're cautiously optimistic that, and I suspect we will still have a loss, that the loss will be the smallest loss of the 3 months. Only because we have the elective surgeries, And we've seen a modest but steady increase in patients coming back to our practices. We've seen an increase in work in the therapy area. Now we've really seen an increase in the lab because of all the processing of specimens for COVID-19 testing. And we're seeing a slight uptick in radiology. So all positive indicators, all suggesting we're moving in the right direction. But I do think, and I've reported this before, this is going to be a 12 to 18 month recovery process. So our responsibility is we have to be good at cost management, cost control, and do all we can to remain welcoming and supportive of our community members using us for our services, and to continue to recruit the specialists. I guess since you asked the question, I'm pleased to report we've signed on 2 new OBGYNs, and there'll be more details coming. And we're in active conversation around bringing dermatology back to the community. So, shortly we'll be announcing a new primary care physician joining us. So yes, it feels like it's been COVID-19 every minute of every day, but there are other things we're doing. We are also continuing work on the surgical enhancements and the revitalization of medical surgical. So we're still working with an eye towards the future, and which I think is crucially important for all of us who work in the health system, so we don't lose our connection to vision and mission.
Brian, can you just update us? I think when we were here last week, you said you would fill us in on the number of county employees that volunteered to take the furlough, and if you ended up with enough. So are there going to be any, I'm trying to think how to word it without saying forced furloughs.
So great question. We had 20 employees volunteer for the voluntary furlough program. Our goal was 26, so we got pretty close. We are not going to pursue any forced layoffs. That is not on the horizon for Lewis County government. We are working on a shared work program, which would allow us to flex some of the hours of county employees, so that as our revenue comes in, we can flex the amount of hours that folks are working without doing too much financial damage to our employees. So we're working on that. We think it's a reasonable solution where, like I've said before, as long as we can monitor things and adjust our spending accordingly to the revenue that that's coming into the door, by the end of the year, what we don't want is to have spent ourselves into a giant hole when we know we've got months of time in front of us to adjust to make sure that doesn't happen.
Will the shared work program be considered by the board at the June meeting? Sorry.
The board passed a resolution giving us the authority to move forward with the shared work program. The details of that program are still being worked out between the CSEA and the county leadership. So certainly there'll be more to come on the shared worker program. I just don't have further details today.
Does the shared work program make up for those 6 other employees? Is that like in place of, instead of like requiring 6 more employees to get us to our number, like the shared work program will get us to our number? Is that?
So we were always looking at a larger package that included voluntary furloughs as well as the shared worker program. The target of 26 workers was based on conversations with department heads. What was the maximum we could accept without, reducing our ability to provide services. So 20 is still a fine number, and we'll still continue to try to implement the shared worker program. So this is all about saving what we can, right? It's, if we can save some now, it will prevent further pain going into the 2021 budget. And I think that our union leadership has appreciated that. I think our employees have appreciated that. And I'm grateful that we have been able to, have 20 people step forward now and have a good working relationship with our employees in the union that will be able to implement the shared worker program hopefully in the next couple weeks.
Any updates on implementing the antibody testing in Lewis County, Ashley?
No updates, it's still not here.
Okay, and same with the analyzer that the hospital ordered?
Yeah, still not here.
Okay.
The
Just have to follow up.
supplier has not given us a date, which makes sense to me, and I think that some of the supply chain issues. So the way I view it is any day in the foreseeable future could be the day. Having said that, we have been notified that reagents won't be available until sometime in June or July.
Okay,
Yeah.
thank you. I'm good.
All right, thanks, guys.
All right, thank you.
Okay, I just didn't want to, can I ask you guys a couple more?
Sure, yeah.
Okay, I just didn't want to. Yeah,